So today, healthcare organizations often wait until the end of a patient journey to begin understanding what happened. Coding quality, reimbursement, and compliance teams are forced to reconstruct a story from disconnected systems, documents, and workflows. AICD-10 takes a different approach. Before we begin, you'll probably notice that parts of this interface look familiar if you've worked with Epic, Cerner, Athena, eClinicalWorks, or other healthcare systems. That's intentional. We don't believe healthcare professionals should have to learn an entirely new way of working just to benefit from better intelligence. So AICD-10 is not here to replace your existing systems. It's here to continuously build reimbursement, documentation, quality, and compliance intelligence on top of the information already flowing through them. So when I log in, I arrive at the Revenue Intelligence Center. So instead of opening dozens of charts, PDFs, lab reports, and billing screens, I immediately see reimbursement opportunities, got full drill down capabilities to know where those come from. I can see all the gaps, the quality concerns, the compliance alerts, pending provider actions, and patient journeys that need attention, and I can access them all directly from here. The platform is continuously monitoring every active patient and surfacing what needs human attention. So my job is no longer to gather information. My job is just reviewing intelligence and approving. So let's go ahead and upload a new document and automatically classifies the document, matches it to an existing patient, or creates a new patient if needed. And then associates it with the appropriate encounter and either uses an existing workflow template or it's a new one for future use. So I'm going to upload a doctor's note here, and it's going to analyze, let me know kind of what we've got. Every document belongs to a patient. There are no orphan files and no separate document managed process to maintain. You can see it's recorded this as a clinical note, and I don't have this patient assigned yet, so I'm going to add it as a new patient here. Let's open a patient here so we can take a look. This is the patient profile. Here I can see demographics, insurance information, providers, diagnoses, procedures, documentation status, reimbursement status, quality considerations, compliance considerations, and just the complete patient timeline. So the lifecycle tab is going to show every encounter and event throughout the patient's journey. So this is the most recent one. I can see past ones only, and it's just going to let me know if I try to make any edits or changes that this is an encounter that is closed. Then the Documents tab contains every source document associated with the patient, organized into just one single patient folder. As new information arrives, the profile continually updates, so lab results come in, notes arrive, procedures are documented, patient's reimbursement, quality, and compliance picture evolves automatically throughout the journey rather than being reconstructed at the end. As a part of that, let's look at quality intelligence. AICD-10 has identified a clinically relevant condition that appears throughout the patient's history but is not clearly documented in the current encounter. So every supporting source is linked directly to the recommendation, allowing me to immediately verify the evidence. Rather than manually drafting a physician query, AICD-10 can generate recommendation clarification for me. It's entirely on information already present in the patient's record, and then as a provider, I can just sign here, just say, I do want to approve it, reject it before it becomes a part of the official record. And for the actual reimbursement package, the Codes tab continuously builds recommended ICD-10 diagnoses, CPT procedures, HCPCS codes, modifiers, documentation requirements, payer considerations, quality impacts, and compliance considerations. Every single one of these recommendations is explainable. You can see the exact source that it comes from, the quoted snippet of what that is, and I can approve or reject any of these, as well as just kind of seeing an overall billing posture of how aggressive or conservative I want to be, and that's just going to help me reduce audit exposure over time. If I agree, I accept it. If I disagree, I reject it. And then if I need to make any changes, I can edit directly. AICD-10 doesn't just automate judgment, it automates discovery. So the human ultimately remains responsible for the final decision. The thing I kind of want to cover today is Henry. He is our workspace co-pilot. So he can summarize patient journeys, locate documentation, explain recommendations, identify opportunities, and navigate the platform using natural language. So I'm going to just try opening a patient. I'm going to start a new chat for me to be able to do that. And so he's going to use tool search patients, going to think, and then actually bring me over there. And then he can help me audit patient charts, identify documentation, and adjust the workflow overall. So everything that I can do as a human, Henry can do for me to help me navigate the tool. And I'm just going to return back to the Revenue Intelligence Center one time, kind of give an example, close out Henry here. So throughout the day, all of that documentation is being just tracked over time. I can see kind of a holistic journey of who's ready to bill, who's completed, who's still in the coding stage, who's in the documentation stage. And then when the patient journey is actually complete, which means I've completed every step and the patient is ready, they're at the end of their encounter, Submission tab is going to unlock. I can submit. At that point, the coding specialist is no longer reconstructing what happened. They're reviewing a reimbursement package that has been assembled, validated, and improved throughout the entire patient journey, which should just make the whole process just faster and more efficient. Can review everything that they've done so far, approve, submit, and then audit, analyze trail. Healthcare organizations shouldn't have to wait this journey to understand what happened. That is what we're trying to cover with this one. Obviously, this is just a rough demo kind of all of the features that we expect to be in the finalized tool, but hopefully it gives a good overview of what we are trying to accomplish. Yeah, I'm sure it's going to change and grow over time as we get connected to live data and start working with offices. Thanks so much.